Alright, team. We have a patient presenting with eosinophilic fasciitis, Nintendo thumb, and acute pancreatitis. What are your thoughts on the diagnosis?
I think it could be a rare autoimmune disorder, maybe something like eosinophilic fasciitis given the symptoms.
But the presence of Nintendo thumb suggests some sort of repetitive motion injury. Maybe it's related to that?
Acute pancreatitis is no joke, though. That's a serious condition that shouldn't be overlooked.
You're all missing the big picture here. It's Juberg-Hayward syndrome, a condition that combines these symptoms. We need to act fast and perform amygdalohypocampectomy.
But that's such a risky procedure. Are you sure that's the right call, Hawks?
I don't know if the patient can handle such an invasive surgery. Maybe we should consider other options?
I agree. We should explore all options before jumping into such a life-threatening procedure.
Damn it. I didn't spend all these years in medical school to be questioned by a group of amateurs. We're going ahead with the amygdalohypocampectomy, and that's final. The patient's life is in our hands, and we will save it, no matter what it takes. Tracy, I need to talk to you about my patient. I strongly believe they have Juberg-Hayward syndrome, and an amygdalohypocampectomy is necessary.
Hawks, I need you to consider other options before jumping into such an invasive procedure. Have you consulted with other specialists about this case?
I don't need to consult with anyone, Tracy. I have years of experience, and I know what's best for my patients. Trust me on this.
I understand your expertise, Hawks, but we have protocol to follow for a reason. Let's not make any rushed decisions here.
Rush decisions. I've been studying this case for weeks. I know what needs to be done, and I won't stand for you questioning my judgment.
Oh no, this is not good. The patient is in critical condition. I need to figure out how to tell Hawks that the amygdalohypocampectomy was not the right treatment for Juberg-Hayward syndrome. I have to be honest with him about this mistake. There's no other way around it.
What the hell were you thinking? You almost killed the patient with your incompetence. Choosing the wrong amygdalohypocampectomy and misdiagnosing the condition. Unbelievable!
But Dr. Hawks, we thought.
You thought wrong. You were all a bunch of imbeciles who shouldn't be allowed near a patient.
No. What do you think the diagnosis is, huh? I still believe it's a case of hippocampal sclerosis, Dr. Hawks.
Hippocampal sclerosis. Are you kidding me? That's the most ridiculous thing I've heard all day. Frank, what about you?
I think it might be mesial temporal lobe epilepsy, Dr. Hawks.
Mesial temporal lobe epilepsy? That's even worse. None of you have any idea what you're talking about. I can't believe I entrusted the patient's life to such a clueless team. You all disgust me. I'll handle this myself. Get out of my sight, all of you. And don't come back until you learn how to diagnose properly. I can't believe I couldn't figure out what's wrong with the patient today. It's been bugging me all morning.
Oh, come on, Hawks. Maybe you missed something obvious. Like, did you check the patient's blood pressure or run a full blood workup?
I did all of that, Johnson. Maybe it's something more subtle, like a rare genetic condition.
Or maybe you overlooked a simple infection or allergy. You should always consider the basics.
Wait a minute. I think I know what it is. Thanks for the hints, Johnson.
What? No goodbye or see you later? Hey, Hawks. What did you figure out? Hawks.
I've made my diagnosis. It's adipsia, not Juberg-Hayward syndrome.
Are you out of your mind, Hawks? We can't just disregard established medical conditions like that.
This is unacceptable, Hawks. You can't barge in here without proper preparation or consultation.
I agree with the others. Hawks, you need to follow the protocols and guidelines in this operating room.
I know what I'm doing. Trust me on this one. Adipsia is the key to understanding the patient's condition. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. Congratulations on figuring it out.
You know, this whole ordeal with the wrong diagnosis could have been avoided if you had just listened to me from the beginning.
Wait, what do you mean? I thought I always considered your input.
It's just that. Never mind. Let's focus on getting the patient the right treatment now.